So today's webinar is our second of our CHAMPS COVID-19 response webinar series, and it's called Maternity Practices During COVID-19, a discussion. And so our presenters today will be Laura Burnham and Tawanda Logan-Hurt. So thank you both for presenting today. And Dr. Ann Merwood will also be sharing a few slides before the beginning of the presentation as well. I think everyone should be muted upon entering the meeting, but if you're not, if you wouldn't mind just muting yourself so that there's no background noise while the presenters are presenting. Also, you can use the chat box to type in any questions you might have during the presentation. So just a couple updates from CHAMPS. So Mississippi now has 20 baby-friendly hospitals, which is wonderful. And we just wanted to give a quick congratulations and shout out to the two most recently designated hospitals, which are NMMC Tupelo and NMMC Gilmore Emory. And now I'm going to pass it over to Anne to take us through a few more updates.
Hi everybody, thank you for coming on. Welcome to our enhanced webinar format here. I'm sure you've all become Zoom experts like we have. Actually we're finding that this platform's more fun and more interactive. So we're going with Zoom now instead of WebinX. Thank you all for coming on. As Maytal said, we're doing these webinars now each week in response to the COVID outbreak, which of course here in Boston we're really being hit by. We have almost 60,000 cases in Massachusetts, and our dear hospital, Boston Medical Center, is now 70% treating COVID patients, 30% of whom are in our intensive care units. So it's quite a serious situation up here. And of course, for all of us, wherever you are, very unpredictable. We're not really sure what's going to happen next. So the webinars we have coming up on the screen here, we have Diane Spatz, who I don't know if how many of you know Diane, but she is from CHOP, Children's Hospital of Pennsylvania, and a great leader in the world of nursing. And she's going to speak next week. She's a very lively speaker, and I know she's going to talk about some of the recommendations during COVID, and then sort of one of her themes is going to be how to cope with the COVID outbreak in terms of supporting mother's milk production, whatever is happening in your own hospital. So that's going to be cool. And then we've got a joint webinar on the 13th with the Academy of Breastfeeding Medicine, which we've got our own Laurie Winter on, and also Alison Stuvey, who's currently the president of ABM, and Anne Cullums, who's the president-elect. So they're going to be presenting about the evidence for exclusive breastfeeding in the first week of life with a spin towards COVID and how it's helpful for COVID prevention. And then we have two speakers, one from New York and one from Boston, about community support for breastfeeding women during COVID-19, especially some of the distance work. And also, you know, some of you have said this too, that your hospitals are discharging people early, and how to sort of support the community when they have less access to the medical system during this outbreak. And then on the 27th, we're going to do a joint webinar together with NeoQuick, which is Meg Parker's group. Some of you will remember Meg. She came to the presenting at the MSPQC meeting last year, and she does a lot of work in the NICU. And then June 3rd is our webinar that we already had planned to talk about CHAMPS and what's happening next. So that's what's coming up. So we do hope you'll join us there every Wednesday at the same time. Next slide. Just to give you an update, there are lots of guidelines out there. They don't all totally agree with each other, but these are the guidelines on COVID that relate to breastfeeding, skin to skin, and those kinds of things, rooming in. And the WHO's stuff came out yesterday night, and it's really cool that they just have a very detailed one. This frequently asked questions is very helpful. Brand new off the press last night. Couple of things that they did update it with. One is that they still recommend skin to skin, regardless of whether the mother is suspected or confirmed as a COVID patient. The whole thing about washing the breast before feeding, they say that basically they should wash the breast only if they're coughing, if they just coughed on the breast, but there's no need to wash the breast before every feed. And then they have a lot of detailed guidance for like how to use masks and things for breastfeeding mothers, and if they don't have masks, what to do, because we can't all get masks. So it's just a very useful document, and it really covers everything. So I'd highly recommend that FAQ document. As you can see, the link is here. We also have the link on our Facebook page, so we recommend that one, and of course the other statements. And Alison Stubbe, who's going to be speaking with us in a couple of weeks, has a wonderful commentary in breastfeeding medicine called First Do No Harm, which I also recommend. So that's all there for your resources, and if you're not on the CHAMPS Facebook page, I recommend you join us, because we put all these things up there as well for spreading them. Thank you. Next slide. So this is a slide we just want to, most of the people on this particular webinar I see are from Mississippi, and hello to all our friends. It's nice to see you. Maybe at the end you should all put your pictures up so we can all see each other. This is the data from the Mississippi Department of Health and the cases you have. It's a funny way to present the data, because if you look at the sort of stuff on the right hand end of the graph, it looks like you have no COVID, but actually anything in that grey shaded area is not to be relied on, because the data are still coming in. So it's before the grey shade that you should be looking. So as you can see, your cases are sort of steadily being creeping up. Maybe leveling off, but it's not really sure, because really the most recent data that you should be looking at is the column right before the grey shading, because the other stuff doesn't come in. But anyway, you don't have anything like the amount of COVID we have up here in Boston, but you certainly have, it's certainly there, and I'm sure you're all having to grapple with it. Next slide, please. One sad fact which is reflected throughout the nation is that minority populations, especially Black or African American populations and American Indian populations, are being hit more than white populations, and that is reflected in the data here. And you have 37% of African Americans in the state of Mississippi, but you can see that well over half of the, well, much more than half of the cases that you've had are among Blacks or African Americans. And we always, speaking from our equity perspective, yes, it's easy to say, oh, well, they have more pre-existing conditions, but as with many other things with African American healthcare, there are many other things that are influencing these rates besides so-called pre-existing conditions. And actually, even in Boston, we've had a big fuss made through mainly our hospital about the fact that many of the pre-existing conditions which would be leading to take people off life support are actually very overrepresented in minorities. So you're already behind the 8 ball before you start. If you have diabetes, you're less likely to get life support, for example. And there's been some attempts to improve that statistic, but those guidelines, but this is the case here. And you can also see here geographically where you have the most in the state. The darkest areas are the places that have the most COVID. And all these data are available on your Department of Health website, so you're probably checking them as well. So, but anyway, I just thought we'd introduce with that. Go ahead. And then, as is the case elsewhere, pretty much the older age groups have more deaths. And as you can see here, you have cases in children, individuals under the age of 18, but so far in Mississippi you've had no deaths in that age group. And I think as we talk about breastfeeding and all the kinds of things that we're discussing on this presentation, it's really important to remember that although occasionally there's a big story in the news about a child getting very sick, the facts support that really very few young people get very sick and very few children get sick. And babies and toddlers really, even if they test positive, they have, by and large as a group, they have almost no symptoms. So this is something that's really worth considering when we're talking about breastfeeding and COVID, because if that baby does catch COVID, the chances of it having any form of severe disease are very minimal, almost zero, unless it happens to be a premature baby or there are some other complications. So, really consider that when you're talking about protecting breastfeeding. You're also protecting it in a group that has low incidence of COVID and very low incidence of severe symptoms or mortality. Next slide. Okay, so I'm going to hand it over at this point to Laura. We have been doing a poll, as many of you will know, because you've answered it, about what the hospitals in Mississippi are doing. And for those of you who are not from Mississippi, you know, just this is representative of a particular state. We have 39 hospitals in Mississippi that deliver babies that are in the CHAMPS program. So we sent this out to all of them. Although it may not be applicable to your state if you're not from Mississippi, I think it's a nice cross-sectional study of a very large group of hospitals throughout one state in many different places, in rural, urban settings, wealthier, poorer settings, etc., etc. A big cross-section. So I'm going to hand it over to Laura, and she's going to present the outcome from this study.
Great, thank you, Anne. So like Anne had said, my name is Laura Burnham. I am the Cheer Project Director for our office. And then after me, Tawanda Logan-Hurt will also be presenting. She's going to be presenting about what's happening in the Delta, and she works with WIC in Mississippi. And she's our CHAMPS Delta Community and Hospital Consultant. Great. So today I'm going to share with you the COVID-19 survey results for our Mississippi CHAMPS hospitals. So we went ahead and we surveyed our hospital task force leads about changes in hospital practices that had been made in response to COVID-19. So the survey was distributed on April 16th, and a reminder was sent to everyone on the 21st. And so today I am reporting results as of April 27th. Next slide. So task force leads from 28 hospitals responded to the survey, and they represent 72% of the CHAMPS hospitals in Mississippi. Next slide. So one of the first questions we asked was, which services or practices has COVID-19 changed or affected? All of the hospitals selected that the visiting policy had changed at their hospital. So all 28 hospitals said that that had changed. The next most popular change was length of stay. So 8 hospitals reported that length of stay had changed at their hospital. Only 2 hospitals reported that skin-to-skin care had changed, and only 3 hospitals reported that rooming in had changed. So by and large, visiting policy has changed in Mississippi hospitals, but there weren't a lot of other practice changes that had happened so far. Next slide. When we asked specific questions about the visitation policies, 100% of the hospitals reported that OB had reduced the number of visitors and support people allowed for laboring women. Next slide. When we asked who specifically was allowed in the labor room with the mother, 71% of hospitals reported that only the father or the partner was allowed in the room, and 29% of hospitals selected the other option. Of the people who selected other, 7 said that one support person was allowed in the room with the mother. So just a support person in general, not specifically the father or partner, kind of any one of the mother's choosing. And then one hospital, oops, if you can just back up, sorry, one hospital reported that 2 people were allowed in the room with the mother in the labor room. Next slide. When we asked whether postpartum had reduced the number of visitors and support people allowed in the room with the mother, 100% of the hospitals again reported that that had happened and postpartum had reduced the number of visitors. When we asked specifically who was allowed to visit postpartum, 64% of the hospitals reported that only the father or partner was allowed to visit. And then 36% of hospitals reported or selected other. And then of those other responses, 9 hospitals reported that one support person was allowed to visit postpartum, and then 1 hospital reported that 2 people were allowed to visit postpartum. We also asked specific questions about how skin-to-skin practice had changed. So if you remember, only 2 hospitals reported that skin-to-skin practice had changed for them. One hospital does not allow suspected or confirmed COVID-19 mothers to do skin-to-skin. And then the other hospital didn't specify what change was made around their skin-to-skin policy. When we asked specifically how rooming in practice had changed, of the 3 hospitals who did report that rooming in changed, only 2 of those hospitals specified what those changes were. So for healthy mothers and babies, both of those hospitals strengthened their rooming in policies to limit the risk of COVID-19 exposure for the dyad. As far as suspected and confirmed COVID mothers, one hospital is not allowing rooming in for those dyads, and then the other hospital has not created a policy yet around COVID because they reported that they hadn't experienced a COVID patient yet or encountered a COVID patient yet. We also asked a question, or we asked hospitals to report with regard to infant feeding any changes that they had experienced. Next slide. So the majority of hospitals reported that they had increased messaging around the importance of breastfeeding during the COVID-19 epidemic. That was 54% of hospitals. And then they also reported continuing to recommend that breastfeeding babies see a clinician for an in-person checkup within 48 hours of discharge, and that was 82% of hospitals. Other hospitals or other common responses kind of centered around issues around hygiene. So hospitals, or 39% of hospitals are advising COVID-19 positive mothers to pump rather than feed directly at the breast. And then other hospitals have also created guidelines about increased hygiene for breastfeeding and bottle feeding. And that was 43% and 36% respectively for that. Finally, 0% of hospitals, or no hospitals, are encouraging mothers to formula feed during the COVID-19 epidemic, or recommending that mothers and babies stay home and do not visit a clinician for an in-person checkup within 48 hours of discharge. So the final question on our survey was an open-ended question, and we asked hospitals to please describe any other actions they had taken in terms of COVID. So we found that many hospitals who had not previously noted changes to practice had a COVID positive mother or a PUI. So some of these changes included separating mothers and babies immediately after birth, or continued rooming in with proper distancing and hygiene, or giving mothers a choice to separate or room in. Other hospitals mentioned different PPE and mask requirements that they had for patients and staff working in maternity care, or COVID testing for women in labor. Next slide. So kind of just to summarize these initial survey findings, we found that all hospitals have changed their visitation policies, and that most are only allowing the father or the partner or one other support person to be with the mom in labor and postpartum. Only a few hospitals report changes in their skin-to-skin and rooming in practices, but this may change over time if COVID-19 infection increases in Mississippi. And although many hospitals haven't yet experienced practice changes in things like skin-to-skin and rooming in, more questions need to be asked to these hospitals about whether policies are in place if and when the COVID-19 rates do increase and they do start seeing mothers in labor with COVID. And just based on kind of the open-ended questions at the end of the survey, it looks like many of the hospitals in Mississippi do have plans in place for when and if this happens. Next slide. Okay, so as Anne mentioned, we have a poll for you all. So we surveyed the Mississippi CHAMPS hospitals. We'd like to survey all of the webinar attendees as well. So our questions for you are, has your hospital cared for a COVID positive or PUI mother in labor or postpartum? The second question is, do you have plans or policies in place for how to care for maternity care COVID positive or PUI patients? And then, is your hospital doing universal COVID screening for all women entering labor? So Maytal is going to send everyone the poll. We'll give you a few moments to respond.
This is Anne here. Just, for those of you, in case this is a new, one of our new skills is doing polls. So just to explain, you should see on your screen there the questions that they should have popped up for those of you who are joining through the Zoom thing. And you can click yes, no, or in the process for the different answers. So let's see if people are doing that. And then I don't know how, Mital's going to do something magical and we should be able to see the results.
Yeah, and we recognize too, like these questions are pretty hospital specific. So if you are someone from the community or someone who's attending who doesn't work in a hospital, that's fine. You don't have to respond to the poll. And then also, I think we're holding questions until after Tawanda presents. But if you do have questions about the survey or just about kind of maternity care practices in general in the hospital, be sure to enter them into the chat box. You can send them directly to Maytal, and then she can bring them up at the end when we open it up for questions.
All right, this is Maytal.
The poll. So okay, go ahead, Maytal.
Oh, I was just going to say, I'm going to release them in about 15 seconds. So if anyone has last answers to get in.
Oh, cool.
Okay. Well, it looks like it's about half and half here for a little bit over half work in a hospital where they have not cared for a patient with COVID or a person with suspected COVID. That's 53%. And then 47% of you, your hospital has cared for a COVID positive or a PUI mother in labor or postpartum. Let's see, but in terms of plans and policies in place for how to care for COVID patients or suspected COVID patients, 79, so the majority of you all have plans in place, which is good, in case you do have patients who have COVID or suspected COVID. And some of you all, your plans are in process. Let's see, so that's good. And then, is your hospital doing universal COVID screening for all women entering in labor? So again, this is about a 50-50 split, but 53% of you, yes, you are doing that universal COVID screening for women entering in labor.
Thank you. Thanks for doing that, guys. I would just say, obviously the whole thing about universal screenings are huge all over the world, because we tend to look at rates based on obviously screening. If we're not screening, we can't count them. So actually, even Boston Medical, where we have loads of COVID, we're not doing universal screening for pregnant women entering the hospital in labor. So I think that's great that so many of you are doing that. Actually, that's really cool that you've got that, because that would mean that your data are really accurate in terms of the number of cases you've got. So thank you all for sharing that.
Great, thank you all so much. And now I'm gonna pass it on to Tawanda.
Hello, everyone. I don't see my, can y'all see me? I don't see myself.
We see you.
Oh, do you? Oh, okay. Well, my name is Tawanda Logan Hurd. I'm the Mississippi Delta Community and Hospital CHAMPS consultant. And I'm also a WIC breastfeeding, regional breastfeeding coordinator. And today I'll be speaking on the community support for mothers in the Mississippi Delta. All right, you'll have to control it. I can't advance the slide. So the roles that I play in my work profession, I'm a certified lactation counselor, I'm a baby cafe facilitator, and also the state baby cafe coordinator. And my main role with is the WIC regional breastfeeding coordinator. And in these roles, we receive referrals from community organizations, from hospitals, WIC clerical and certifying staff for pregnant and breastfeeding mothers to help them receive education and assistance with their breastfeeding experience. Next slide. So in the midst of this pandemic, we have made several changes so we can be accommodating to our clientele, but also be safe. So we have started providing remote services for pregnant and breastfeeding moms. That's through our baby cafes as well as through our WIC services. So in our baby cafes, we offer Zoom meetings, and they're provided by the facilitators. There are various ways that they can get an invite. If the facilitators already know their email addresses, they could send it out that way. They're also advertising on social media. They're also, if anybody else, any other organization has contact with the clients, they're presenting that information, and that way they're, posting it in various ways as well. And we're also making sure if we do have to have in-person visits, we're making sure we do it in a safe method. We're wearing medical masks, and we're wearing gloves, and we're making sure we use proper hand washing techniques as well. Next slide. So there are other remote resources that we provide for the pregnant and breastfeeding moms. For our WIC staff, we have access, unlimited licenses to the Pacify app. And you can see the picture down here that shows you it's a mobile app that you can download, and you have unlimited access to a live lactation consultant. So the WIC staff has the codes, and it's free of charge. We'll give it to the community. They can have access 24 hours, 7 days a week to a live lactation consultant. And we also are able to share our Ready Set Baby curriculum that we have access to online education now. We were doing it face-to-face with all the delivering hospitals that have signed up for us to partner with each other through the MOU. We were able to go on site to their location to provide the Ready Set Baby curriculum to any pregnant or breastfeeding moms that want to attend the classes. But now we are able to share it electronically, and they can complete the various lessons, and it has a session in there where you can get tested what you have learned and what you have went over. So, and then we can also use that for WIC, and that could be part of them renewing their vouchers, and that can be their nutrition education as well. And so with WIC, we've also had some modification in the devices that we issue. Right now, we're not issuing our multi-users, which were usually mainly used for moms that are separated from their babies or that couldn't put their babies to the breast. We're only issuing our single users. Those are the ones that do not have to be returned. And it's due to just sanitation methods, making sure that, because if we were issuing the multi-users and it was in contact with households that, were COVID-19 carriers, then we couldn't guarantee that we could sanitize it thoroughly. So we're issuing the ones that do not have to be returned. Next slide. So some changes with our WIC staff and our volunteers, it has been a big change for us because we're used to that personal touch. We're used to developing that relationship and that building that rapport, having that face-to-face, in-person, contact with our clients. So now we do offer remote WIC certification and education, and it through phone call mainly. We will call the ones that are already appointed in our system and offer them phone interviews for their WIC certification or nutrition education. And they don't have to accept it, but more of them have been willing to receive the phone interview. It does take a little longer, and we explain that to them, and then we explain all the procedures with them when we call to offer it to them, so they can know to expect our call, and we'll give them a leeway of if they miss it, how they can call us back within that time frame before we move on to the next client. Also, some other ways that we're working through this pandemic is we're offering curb service. We're able to go to the car to provide services or deliver devices to clients rather than them having to come into the clinic or us having to do home visits. And we're doing routine screenings for everyone that comes in. We're asking the ones that you can see in this picture if they've had a fever of over 99 degrees, if they've had a cough, shortness of breath that can't be contributed to any other illness. And then we're stopping them before they get all the way into the clinic, mainly in the foyer area, and asking them those screening questions. Next slide. So the next steps, we're planning on continuing to support and offer guidance with the telelactation support. And we're enhancing our education and virtual support, making sure that getting the word out there, making sure that clients feel comfortable joining us, and that they are aware of what we're offering, because we don't want them to think that we've just dropped them by the wayside and forgot about them. That we're still here helping them and being their support and guiding them as much as possible. And in the near future, we've been working on it a while, but we are still working towards moving our WIC food services out of the food centers and into grocery stores. So it could be in a location where they already frequent. So, that can cut down on their, them having to be exposed. But it's not going to happen, right now during this pandemic, but it's still in the making and in the near future. Next slide. I think that's it.
Great. Thank you so much, Twanda.
Okay, you're welcome.
And I think now we're ready for questions. So we already have a few questions, and if you have more questions, feel free to chat them in. So our first question is from North Mississippi Medical Center, and the question is, for the hospitals that are doing universal screenings, are they using nasal swabs or antibody screens for the hospitals that are performing universal screening, what is their asymptomatic positive rate?
Guys, if you want to speak up, please just unmute yourself and just click that little microphone in the corner so you're unmuted, and you can, let's hear what other people have to say. Could you repeat the question, Metal? Sorry, just repeat.
Yeah, absolutely. So for the hospitals that are doing universal screenings, are you using nasal swabs or antibody screens? And
why don't we start with that one? Let's start with that one. So those of you, anybody got any responses to that? How are you screening? Nobody knows. It's okay. If you don't know, you don't know. I'm curious, the person who asked the question, do you know what kind of screening you're doing? And I can't see these questions in the chat, so maybe they were sent just to Maytal, but I can't see the questions. So.
Yeah, they were sent just to me.
Okay.
I'll speak up. This is Dr. Henderson from Hattiesburg.
Hi.
We are not screening everyone coming in currently, but we just got information that our surgical services are going to need to screen all pre-op patients, and those will be done using nasal swabs. The antibody tests are fairly unreliable, so no one generally is using those antibody tests, and I don't believe any are accurately or right now FDA approved. So I would think that most people are using the nasal swabs. Some hospitals have a 24-hour turnaround. So those would be the only ones that would be helpful, would be those nasal swabs if they had a very quick turnaround.
That was great. Thank you. Thanks, Anita. That was really useful. And what was the second part of the question, Maytal?
Yeah, the second part of the question was, for the hospitals that are performing universal screenings, what is your asymptomatic positive rate?
It's probably quite complex. But it's a really good question, and people might be preparing or looking at their notes. But I will just say a couple of things from our perspective. You know, when we did this survey, I think it raised, as Laura said it to me, it raised more questions than it answered. And I think we're going to do another survey. Sorry guys, we'll make them as simple and clickable as we can. And these kinds of questions are really useful to know, because, you know, knowing how many people are asymptomatic is really helpful, and that kind of data is actually really valuable across the world, not just across Mississippi or in your hospital. So do people have any information on asymptomatic?
I'm looking real quick. I was involved in an Ochsner webinar a few weeks ago, and Ochsner is screening all moms. And I want to say that they are asymptomatic, or all their moms rate were like in the 10%. I can't find that, but Ochsner is screening all moms who are coming into the hospital. Ochsner in New Orleans.
Interesting. Cheryl from BMH Union County put into the chat here that BM Baptist Memorial Hospital Union County is doing universal testing on all OB patients. If they're scheduled for an induction or C-section, then they're brought in within 72 hours of the appointment. And if they come in active labor, we swab. We do not do rapid tests on OB patients unless they're symptomatic. Rapid tests take 45 minutes, and our send out test takes 8 to 24 hours. So that's interesting. I mean, and the other question, and this would be great data if you guys have the data, and we could, you know, again, be very anonymous in the way we present the data, but the big question also is how many babies catch it. And so, like, I don't know if anyone, we won't identify the hospitals. If you don't need us to, you just put your name in. But I'm curious if people are being screening moms, and then what proportion of those babies are actually symptomatic or testing positive. Both those are two different questions, but I'm curious if anyone's looked at that in their hospitals. So of the mothers who test positive, what proportion of the babies are also positive?
The information from Ochsner again, they screen all the moms as they come in, and their data gave about a 20% positive rate on all moms who are coming in. Of course, that's New Orleans, which also has been a hotspot compared to Mississippi. And of those babies, they had not had any positives. They were screening positive moms at 24 and 48 hours with the nasal swabs, and they had not had any. I was also on a call with UMC last week, and they had 4 positive moms within 5 days, and all of those 4 babies tested negative.
Interesting.
But they did have one baby come back in last week at 1 month of age testing COVID positive, and that baby was hospitalized.
Yeah, thank you, Anita. That's really interesting. Cheryl adds here that they've tested about 30 asymptomatic mothers, and they have not had a positive among them. And I will share them again. This is not to be put into writing, but I'm just sharing. At our hospital, in Boston, we've had about 19 COVID positive mothers, and this is without universal screening, so presumably they were symptomatic, and we've had about 5 babies of those mothers have tested positive. But one point to make is that we don't actually know at this point whether there is vertical transmission in utero. There is no data to show that there is any vertical transmission, but there are some data showing that newborns are getting it very quickly, so it's not clear. Also, as those of you who were on the webinar last week will remember, Dr. Devanzo saying there was the COVID virus is not being shown in the amniotic fluid or in the vaginal secretions. So right now we don't have any proof that moms give the baby COVID before the birth at all. But there definitely are some babies that are testing positive soon after birth. But again, I would say all of them, except for some very rare cases where prematurity, sometimes COVID has been associated with premature birth, and those babies may have problems, but generally the ones that are positive are not having any problems. Anyone else got any feedback?
And I would just wanted to add one thing. So Boston Medical Center, Ann and I, we get like emails from Boston Medical Center all the time with their updates from the pediatrics department. I haven't seen any updates from those emails, but NPR, so in our local WBUR in Boston, they did publish an article recently that said our hospital was doing universal testing for mothers who come in labor. And they said it was the nasal swabs.
Well, it's interesting you say that, because our department, when I asked them yesterday, said we were not. So
very interesting. Yeah, so I'm not sure. Maybe NPR got it wrong.
I think that NPR got that wrong. Yeah.
I also think some people are confused by saying universal screening when you ask those screening questions about fever and exposure, and they may think that is screening, but those are screening questions, not screening swabs. Screening swabs.
Very good point. Anyone else like to share anything, or anyone, Maytal, I don't know if anyone sent you any more questions.
I have a question. Tawanda, how are your Zoom meetings going? What is attendance like, or how are your clients receiving those Zoom meetings?
Yeah, and I was going to add to that, Tawanda, it's part of the same question. If you're finding that the baby cafes actually have more participants when they're online, so could you share a little bit of that with us?
Well, I think the picture that was on that slide showed it was the actual baby cafe Zoom meeting that took place yesterday. It was the Let's Talk Delta Baby Cafe that's in Indianola. So you could see the two that's showing the pictures are presenters, or they're professionals. The other ones is one other that's peer counselor, but the others they're actual mothers that have attended. And I think this is really a good increase compared to when it was in person. So you can see that they're not willing to really, show their face, but that's fine because they're in their, comfortable environment. But as long as they're on receiving the information, that's a plus.
That's actually really interesting, isn't it? I mean, it's cool that you get. I mean, people are, cool. That's interesting, and it's being well received, which was the other person's question. Like, are you finding as a moderator or people involved or feel maybe even more comfortable asking questions than in person? I don't know how are you finding that?
Yeah, they're able to type into the chat. They ask us to share, as much information about breastfeeding as possible. They're able to share information with each other about what they've heard or what others have said about their experience when they're going into the hospital, things that they have heard about the changes and all as well.
Cool. As Cheryl puts into the chat here, if you can't get our hair done properly, who wants to be on camera? I have to think, I must say, I think of all you ladies in the South, particularly with your hairdos. So definitely this is, yes, this must be a big problem. I also, I just remember how everyone was telling us when we were there about how the huge family is coming into the labor and delivery and to postpartum, and you have huge families. That must be quite a big change for a lot of people not to have a family there. During labor and during the postpartum period in particular. I know Kathy Carruthers is on the line. Kathy, I know you had shared something with me about doing meetings through your church online. I just wondered, are you still there, Kathy? Yeah, you are. Do you have anything you'd like to share with us about your experience with the community that you've been working with yourself?
Sure. So one of the things that our church has started doing, I guess I could activate my video here.
Oh, lovely. We can see you.
There we go. Okay, there I am. My ugly hairdo. That's about 4 different colors right now. So anyway, our churches down here on the coast, and Mississippi is a huge, we're part of the Bible Belt. So the church is really the center of the community. And one of the things that most of our churches have done have been online worship services, but many churches are also doing other kinds of community-based education using the Zoom meetings. So one of the meetings that our church set up was called Tuesdays with Tracy, and Tracy is our children's director. And every week she has moms and various people come on and just talk about ways to work with your children and your family and to stay safe during this time. And she asked me to be on one of her events. And so we address questions that folks in the community might have about, is it safe to breastfeed? Is breastfeeding still a good idea? And how, one of the questions that we received from quite a few people was, is it safe to go to the doctor? Is it safe to take my baby to the pediatrician for those well baby checkups? So we were able to address those questions and assure mothers that if the baby needs shots or has needs those early well checkups, that those are really crucial. And of course, we urged moms to talk to their doctor if they were worried about this before they go into the office. So if there's some precautions that they need to make, that they can make those arrangements. But I find that a lot of mothers really worry about whether that's safe for them to do.
Thanks, Kathy. That was really helpful perspective. We have a question here in the chat which says from Brittany Musley, says, I'm working on a project that focuses on racial gaps in infant and maternal health, primarily with African American mothers with the disproportionate rates among African Americans with COVID. What do you think would be beneficial for mothers in terms of education and outreach? One thing she's focusing on is implicit bias. If anyone has any response, I'll just share with you, what my hospital did, while anyone else can either type in or think of any responses. So it was almost quite well, it was tragic, frankly, that the hospital has to come up with, and hopefully you're not in this position yet there, but the state as a whole came up with critical care guidelines, which really were basically sort of life and death guidelines about who would or would not get a ventilator if all the ventilators were taken and all the intensive care units were filled. And it was a very complex equation, and actually the state came out with it, but they sent it out to hospitals, and hospitals were able to adapt it. And our hospital is the the inner city hospital in Boston, so we have a lot of racial and minority patients. And what they had said was, that the guidelines implicitly or even implicitly biased against treatment for certain racial groups in the question of life and death. And actually the first thing that sprang to my mind was the Native American population. I think we have a few people on here from Navajo Nation where they're very badly affected, and there's very high rates of diabetes in that population, and diabetes is one of the sort of pre-existing conditions that would be considered in terms of, you know, quality of life, length of life, whether or not people should get the vent. So actually, fortunately, in Boston, they did do a big thing about this, and they changed the guidelines so that there were other things. And I'm not intimately involved with that process, but they actually looked at the guidelines and said, how would these guidelines be biasing against people from racial minorities in a very big range of ways, and actually came up with some adaptations. So that was definitely a very proactive way to change the end of life support system, in, you know, proactively countering those implicit biases. So that was one thing. I don't know if anyone else has any other thoughts on that. And actually, it would be cool if you want to send us an email afterwards, Brittany. I would be really interested in engaging in that question a little bit more. Kathy has a question. And yeah, I sort of think of this too. We saw there was a horrendous case of a doctor in New York that committed suicide, that couldn't quite manage it anymore. And Kathy's question is, how are you as healthcare professionals caring for yourselves and your own mental health during this pandemic? Does anyone have any things? Laura and Maytal, just while you're there, can you keep track of all these questions? Because these will be wonderful things to add into our surveys going forward as well.
Absolutely. I've also gotten a couple more in the chat privately.
Okay. Kathy just volunteers the information that their church is doing online yoga Zoom meetings every week to try and keep people calm. Anyone else got anything? Maytal, have anything to report from your chat? You're muted right now, Maytal.
Yeah, no one has answered anything, but some more questions.
Well,
But
feel
does
free to
anyone
send
have
us.
any?
Obviously we need to be doing some polls as well. We'll do some more polls next time for putting these questions out there. It's a new skill we've just mastered, so we'll have a go at that next time. You have any more questions, Maytal, in the chat?
Yeah, so one more question is, what changes have you all made in step 10 currently with social distancing in place?
I'm sorry, that was really, can you say that again a bit louder?
What changes have you all made to step 10 currently with social distancing in place?
Okay, so step 10 is referring to the community. And we did look at that in the poll, and I found that actually many of you still are recommending or doing inpatient visits with pediatricians. I'm also curious, because we really don't have as much of that in Boston. Most of the outpatient stuff has ground to a halt, and in fact our pediatrics teams actually go to the communities to do things like vaccinations. They've got like a mobile unit. So does anyone have a response to that?
We're still seeing our babies, you know, at 2 days in the clinic, and then again at 2 weeks. But I'm not sure as far as those outpatient lactation support groups. I would say probably, you know, what Tawanda had said as far as the Zoom meetings for follow-up. Other than that, I don't know.
Veronica has typed in an answer to Kathy's question. Veronica Hendricks, she said that she's no longer working at the bedside on the front lines, but she does communicate with those who do. And definitely taking a break from social media, where the information can often be frustrating, is one of the ways that people are protecting their mental health. Tawanda, did you have a response to something?
Yes, and I also we use that Pacify app, and we are willing to share it with any organization, any hospital. You know, they can refer the clients to us, the patients to us, and we can give them the code. So that's the way that we're also using social distancing.
Do they have to be WIC participants to
No.
call you and get that? No. Okay.
Tawanda, we have a couple more questions for you as well.
Okay.
If WIC participants have responded to the online version of Ready Set Baby, and have you heard any feedback about that online resource?
Well, I have to check with my staff in regards to that, because they're the ones that do the education, and I encourage them to send it out to their participants. So I would have to check with them. I think one of my care counselor that's on here. If she want to chime in, I'm not sure. But I will check with them and I'll let CHAMPS know.
Thanks, Tona.
You're welcome.
And one more question. I don't know if you know off the top of your head, but do you know if most people are still choosing to do WIC certification in person, or are they mostly choosing to do this remote WIC certification?
Remote, by phone, yes.
Interesting.
And that's scheduled to be just until the end of May, and it's going to be reevaluated.
So Kay Reeves, is that your peer counselor, Tawanda? Anyway, Kay.
That's from Greenwood LaFleur.
Okay, great. So Greenwood LaFleur is saying, okay, great, that for step 10, in addition to giving out the community resource sheet, they are giving out flyers for the community partners Zoom meetings. So that's good. That's an adaptation to step 10. Thank you for that.
And I'm responding to Jenny. Yes, Jenny, I'll send you that that link for the Ready Set Baby online class.
Okay. We will definitely be putting, we have to get out some information to everybody. These questions are great, and then thank you all for your interest. I did want to say that the next few webinars, as we have speakers presenting, but we at the CHAMPS team are going to be staying on for half an hour, not for this one, but for the next one. And the next few webinars, we'll be staying on for an extra half hour after the webinar so that we can help people with any individual questions. And we'll get some of our nurse provider type people to be on there too in case you have medically related questions. So we wanted to just give you a forum, any of the hospitals, especially those of you who are still hopefully you're all still working on Baby Friendly, but those of you who are still struggling with Baby Friendly or have things that you want to ask about Baby Friendly, we certainly don't want to have COVID take over everything. It's heartening to know that hospitals have strengthened their rooming in policies, and that so many of you are still doing additional promotion for breastfeeding, because we don't want to lose any ground in this period. But we will be keeping these webinars open for another half hour afterwards when we go forward with the next set. So that if anyone has questions, even if you didn't want to do the webinar, if you wanted to come on for half an hour at the end, if you have questions for the CHAMPS team or that you would like to discuss with each other, we will be doing that. Okay, and any other questions before we
I
wrap?
have one question that I thought that I'd like. So I just spoke with one of my hospitals this morning, and they actually said that because of COVID and their changes in their visitation policy, because there's only one support person allowed in with mom, they're not having, the barrage of visitors that we hear about in the South of everybody and your second cousins and your third cousins coming in to see the baby. So they've noticed that their breastfeeding rates have gone up. Their skin-to-skin success has gone up, and it's easier for them to do skin-to-skin, and rooming in has gone up, and it's just easier for them to do rooming in because they don't have a lot of visitors. Moms are less tired. Moms aren't hearing, other messaging from other people that goes against what the hospital's saying. So I found that really interesting, and I was just wondering if anybody else has had that experience or had a completely opposite experience.
I'll say I spoke to a mom. I saw a mom yesterday for a 2-day visit, and she was only in the hospital for 24 hours, but she said it was really a good 24 hours compared to her baby that was born 2 years prior, because it was just her and her husband, and they had a lot of family time, just the three of them. So she actually was not upset about the policy changes, and she was actually pretty happy about it.
Many of us
Silver linings.
Yes, absolutely. And just to sort of remind you on that note that you all, you Mississippi hospitals out there, you're going to be continuing to collect your data, and it's going to be really interesting. We will have have your data during this period, as we do for all the other months. So besides the answers to the questions that you have and knowing where the COVID cases are or not, we will actually have the data. So it's going to be really interesting to see if breastfeeding rates have gone up. And that's just a really good point, Laura and Anita, that, you know, maybe they're not going up because people want to protect the baby against COVID. Maybe they're going up because they don't have so many visitors. North Mississippi adds here, we've had many compliments from patients about the limited visitation.
Mm-hmm.
Maybe, you know, there's now all this stuff about shared decision making, and a couple of our speakers are going to talk about that in the next 2 weeks. But, you know, maybe going forward, something people could propose would be like shared decision making with the patients about actually whether they want all these visitors or not. Because everyone's reluctant to upset the families and including the providers, but the patients, you know, if they don't have a choice, sometimes it's not a bad thing. So that's really interesting, and it's a very interesting variable with regard to some of these practices changing that, you know, maybe hasn't been thought of or addressed in other places. Okay, I think we're about out of time. I don't know if we have anything that we want to wrap it up, or anyone has any closing thoughts. I do thank you all for your presence here. And Tawanda, thank you very much for your really interesting insights from the Delta and the community. I need to thank you for so many contributions from you, and Kathy as well, and to my team for compiling the survey and putting the results out. So we will definitely be doing another survey because we have a lot of questions. We do hope that you'll send us your data. It's de-identified, but it's going to be really useful data. It's be something that in a de-identified manner we can probably publish about Mississippi during this period. And then just to invite you all to our webinar, same time, same place next week, by Diane Spatz, who, if you don't know Diane, she's a really great speaker, and she is a nurse PhD, and she has really great perspective from the nursing angle. So I think you'll really enjoy her presentation next week. And please feel free to email us with any comments or feedback. And many of you have stayed on for this whole webinar, and we have a high attendance rate. So thank you all. And please do take care of yourselves. Do your yoga or whatever it is you need to do to keep healthy, or stay away from your visitors, whatever. And have a good week. And we hope many of you will be back with us again next week. Take care, everybody.